Holistic connection. Let's heal. Holistic connection. Let's learn. Holistic connection. Let's grow. Holistic connection. Let's be real.
Hello, everyone. This is PamelaTopjian. Welcome to Holistic Connections, Conversations with Holistic Practitioners. Today, my guest is Christine, and I will ask you to please introduce yourself and share what you do in the holistic healing space.
Well, thank you so much. Yes, I'm Christine Trafford. I am a craniosacral therapist and somato-emotional release facilitator. Um, what do I do? I don't know. People always ask me that, and
Yeah.
I help people with a variety of different issues. Generally, I focus on chronic pain, anxiety. I see a lot of people who are living with PTSD,
Mm.
and really just a lot of different things that arise when stress goes
Yeah.
unchecked in the body, whether that's physically, mentally, emotionally, spiritually. It
Mhm.
all just sort of ends up manifesting in various patterns of disease. And that's when I come in.
Yeah, yeah, it's all so connected, isn't it? It's just
It is.
amazing. Yeah, it's
It
really
is.
amazing. So I know that this is hard, but this is one of the reasons I do the podcast is if you could explain kind of what it actually means, the services that you offer and the work that you do for somebody who's never heard those terms, what does it actually mean?
I think craniosacral therapy is so confusing for so many
Yeah.
people because if you Google it, it says something like light touch manual therapy that, like helps relieve deep tensions within the body. It's like, oh, that clarifies things, you
You're
know.
right, right.
And it's even funnier because when you actually go get craniosacral therapy, a lot of people are just like, what just happened? I don't
Yeah.
really know I know something big just happened for me, but
Mm-hmm.
I don't really know what just happened. So when I explain it to people, I find it a little easier to start with what the craniosacral system actually is.
Yeah.
And so the craniosacral system is just like the respiratory system or the digestive system or the reproductive system. It's a system in your body comprised of the brain, spinal cord, and then the connective tissue around that, the meninges, right? The cerebrospinal fluid that it's bathed in. It might be good to put in a little picture. I have a little picture of what this looks like to illustrate for people. I think it sometimes helps. This is what we're talking about. And cerebrospinal fluid bathes the brain and the spinal cord. And really it's like blood that's crossed
Mm-hmm.
the blood-brain barrier, right? So it doesn't have any of the things that are going to be caustic to neural tissue in it.
Yeah.
But it carries oxygen, it carries nutrients, and it carries away all of the waste products. And because it is across that blood-brain barrier, it's not being pumped by the circulatory system, right? It's
Mm-hmm.
not being pumped by the heart like the blood to the rest of the body is.
Mm-hmm.
And so it flows in a closed hydraulic system. It comes in and flows all the way down to the bottom of the spinal cord, the sacrum, right?
Mm-hmm.
Craniosacral,
Yeah.
flows down and then gets sucked back up and processed back into the bloodstream and carried out of the body.
That's amazing.
It is. It's
That's a
so
great
amazing.
explanation. Yeah.
And it's a very subtle rhythm. It's much
Mm-hmm.
slower than your pulse, like your heart
Mm.
pulse. It's between 8 and 12 beats per minute,
Oh.
usually in healthy people. And but it is palpable. It's
Mm-hmm.
something that you can palpate. And when it is out of tune, we use square, symmetry, quality, amplitude, and rate.
Okay.
So is it symmetrical on both sides of the body? What's the general quality of it? Is it kind of weak
Mm-hmm.
and thready? Is
Mm-hmm.
it really strong? The amplitude of it, like how far out and how far in
Mm-hmm.
it's going, and how fast it is, the
Yeah.
rate. So as craniosacral therapists, we come in and we use our hands to palpate the craniosacral rhythm at different parts of the body. You can actually palpate it throughout the entire body, all the way down to your toes, because we're talking about the central nervous system
Yeah.
here. Anything that's happening in that central nervous system is going to happen throughout your whole body.
Yeah.
And so you can find restrictions that are keeping that craniosacral fluid, the cerebrospinal fluid, from flowing freely and bringing those fresh nutrients and oxygen and carrying away all of the
Yeah.
toxins, things like that, to ensure that that flow is optimized so that healing is optimized. A
Mm.
lot of times we say that, one of the core tenets of craniosacral therapy is that the body knows how to heal itself,
Yeah. Yeah.
right? The body has this beautiful, innate healing ability, but things get in the way,
Mm-hmm.
right? Whether that's physiological things, chemical things, like there can be chemical stressors from medications or environmental toxins, things like that. Like if there's scar tissue, I mean, there can be scar
Mm.
tissue from blows to the head.
Yeah.
Concussions are very common to
Mm-hmm.
cause restrictions in craniosacral flow, and even emotional stress, like especially intense emotional stress or
Yeah.
long-term emotional stress can lead to these restrictions. And we come in and instead of using force
Mm-hmm.
to try to force these restrictions,
Yeah.
we just come in and provide a very gentle, very safe
Mm-hmm.
space, and then really listen to the tissues deeply
Mm-hmm.
to see, like, what does it need? Is it trying to move this way a little bit more?
Mm.
Is it trying to move this way a little bit more? And then just give it the bolster that it needs, following the tissues.
It sounds like something very gentle
It's
and yeah, and
extremely
moving.
gentle.
Yeah.
I've
Yeah.
worked with a lot of very fragile clients. I
Uh,
mean, I've worked with a wide variety of people,
sure. Yeah.
from professional athletes and veterans. I was a preferred
Mm.
provider for the VA for
Oh,
about three
nice.
or 4 years, so worked with a lot of veterans, to newborn infants,
Oh,
pregnant women,
nice.
people, older people who are even reaching their transition point in life. So it's very, very safe.
Yeah.
It's very, very gentle, and it's something that can help really just about anyone in some way. It's not a cure-all, but it's very often uh, the underlying thing, the thing that
Right.
hasn't been addressed.
Yeah.
We've looked at all these other factors, we're supporting the body in all these other ways, but we're not actually giving the body what it's asking for
Mm-hmm.
because we don't know how to listen to it.
Yeah. Yeah. And is that something when you're learning, when you're first going through your training and your education, is that part, a big part of what you're learning is how to listen to it? How
That is a
to listen
huge
to
part.
it on somebody else as well as yourself?
Yes,
Yeah.
that's such a good question, because I teach craniosacral
Oh,
therapy
do you?
at
Okay,
I
good.
do. I
Yeah.
teach at a couple of massage schools where I actually go and teach like an introduction class. And then I
Nice.
also do workshops. I teach advanced retreats to craniosacral practitioners that are, moving into more advanced somato-emotional release work.
Yeah.
And I also teach lay people,
Yeah.
just how to work on themselves and on their loved ones. And 100% of the time, the most difficult part for people is learning how to tune in and just listen to that. Because
Yeah.
this is what we call passive palpation. There's
Mm-hmm.
active palpation, which
Yeah.
is like, when the doctor comes in, is like pushing on your stomach and saying, "Does this
Right.
hurt? Does this hurt?" That's active palpation when you're
Yeah.
trying to find something, like, "Oh, here's this shoulder joint," right?
Right.
Passive palpation is where we literally just wait for the movement to happen. We have to
Mm,
sit there and wait and see what it is that the body's trying to do, right? Waiting and listening to that cranial rhythm. And we do not excel at that in this society.
no,
Look,
no.
it is not something that is very widely valued.
Yeah,
within
it's
Western
getting
society
worse as time goes by, I think.
every day. I
Yeah.
really agree with you. And it's really something that I think can help not just with your own personal healing, but I think with just interactions with other people,
Yeah.
with societal healing. I've also, worked with a lot of other therapists on developing ideas around community craniosacral
Oh,
healing.
nice. Yeah, I love
Yeah,
that.
because we're all just, smaller parts of a larger whole.
Yeah,
And
absolutely.
being able to listen to each other, to listen to ourselves,
Mm-hmm.
to listen to,
It might be
you
the
know,
harder part. Yeah.
it's so much harder for
Yeah.
people. So, yeah, so to go back to your original question, that is something that people learn to develop when you're first learning craniosacral therapy, because this is another confusing thing for people as well. And for lay people when they're looking at craniosacral work,
Mm-hmm.
you can just take a craniosacral class. Well,
Mm-hmm.
any healthcare practitioner, any kind of healthcare practitioner can take a craniosacral workshop and then say they practice craniosacral,
Mm.
right? But there's actually a much larger certification involved
Yeah.
that takes years of study and mentorship and some publications for, to practice craniosacral therapy as,
Yeah.
as a therapist. And so it can be a little confusing when you're like, well, my physical therapist does craniosacral therapy, or my RN does some craniosacral,
Yeah.
or my dentist, or my orthodontist, or my, like there's a lot of
Yeah.
different people, which is wonderful. It's beautiful. It's part of the beauty of craniosacral is bringing that into all these different professions
Yeah.
so that people can see that. But it can be a little confusing
Sure. For the
when,
layperson looking in and trying to find, yeah, somebody to
right.
work with them. Yeah.
So it is helpful to look for someone who is going to help with the specific things that you are struggling with
Yeah.
and who has the ability to do some of that deeper work. Go into some things. If you're looking more towards the somato-emotional release
Mm-hmm.
type work, of course, I'm going to be biased.
Yes,
But I
that's
think that
okay.
craniosacral and somato-emotional release are it's the absolute only way that I would go about that kind of work for
Mm-hmm.
myself or anyone that my kids or my husband
Mm-hmm.
or anyone, because I think that's a big thing these days too.
Yeah.
There's with all of the different you go on social media. We were talking about social media
Yeah.
earlier before the show, and I see at least, I get targeted with all of these really showy somato emotional release kinds of
Mm.
things where people are at these retreats and they're sobbing or someone is like
Ah.
whacking them with stuff. And there's nothing against any of that. I mean, if it
Mm-hmm.
works for you, please do it.
Yeah,
Um,
yeah.
the thing that I have noticed, however, with the popularization of that
Mm-hmm.
is that most of those modalities are considered therapist led,
Mm-hmm.
right? And when something is therapist led, that means that we're sort of overriding what the body wants and
Mm.
saying, no, you're going to release this emotion,
Okay, okay.
right?
Yeah.
If this is what you're going to do versus body led, which craniosacral is very body led
Yeah.
rather than therapist led, to where we say, hey, you do what you want to do.
Yeah, we're
You know,
giving you the opportunity to do this if you are ready.
exactly.
Yeah, if that's what's going to be
Exactly.
helpful to you.
Here's
Yeah.
here's this safe bubble. We'll just hold this
Yeah.
safe bubble around you.
Mm-hmm.
You go ahead and fall apart and
Yeah.
shake loose all the things that are no longer serving you, so and then come
Mm-hmm.
back together if
Nice.
you feel ready to do that.
Mm-hmm.
And that is what allows for it to be so safe,
Yeah.
even at those more intensive, more advanced levels of things that not all practitioners provide,
Yeah.
is is because it's never going to be anything that the body wasn't ready for. That's
Nice.
never anything that you weren't internally resourced enough to
Yeah.
be able to handle. It's just something that the body hadn't felt safe enough
Mm-hmm.
to be able to move through and release
Yeah.
yet.
Yeah. So, how did you first become interested in doing this kind of work?
When I first went into college, I decided that, I was going to go into either physical therapy or some sort of medical clinical work.
Mm-hmm.
And so I got my bachelor's degree in health science and pre-professional health. And in that process, you have to do a lot of job shadowing and,
Sure. Yeah.
hands-on work with patients and some
Mm-hmm.
clinical internships. And I saw, wow, this sucks.
Yeah. Yeah.
I really want to work with people
Yeah.
and, in a way that's more individualized
Holistic.
and
Yeah.
holistic. And so as soon as I graduated, I decided I was going to go to massage therapy school.
Mm-hmm.
So I'm touring what would be my massage therapy school,
Mm-hmm.
and the woman giving the tour at the time, her name was Leah, and she had just taken her first craniosacral class.
Oh, yeah.
And so she was very excited about it, right? She was just like,
Sure.
uh, walking me around, and we went to the area of the school where there was a bunch of tables set up where you
Mm-hmm.
can, um, you know, everyone
Practice
would
and
practice and work on each other. And she said, well, why don't you just lay down and I'll show you? Because
nice.
it is sort of vague and hard to understand until you really experience it. So I did, and I laid there and I thought, what is this BS?
Yeah,
You
what
know,
is she gonna do to me?
yeah, well, because it was just sort of, it's so light. And if
Mm,
you're not very in touch with your body, which I wasn't at that point in
mm.
time, it's just sort of like, I don't know what this
Like
person
this
is
isn't
doing right
doing
now.
anything because I don't feel
Right.
anything major, like
Right,
like the pounding on my
exactly.
body. Yeah.
And so then I sat up, and the whole world just kind of swirled around for a minute.
Mm-hmm.
And then my whole body, it's very difficult to describe. Again, my whole body just felt like a different body.
Yeah, yeah.
And that was when I was like, I have to understand this.
Yeah.
Like I need to know more about this. And so, long story short, here I am.
Yeah, yeah.
And and I've also had profound personal healing experiences with it throughout my studies. I
Yeah.
had a serious back injury when I
Mm,
was 14 that left me just kind of always with back pain.
yeah.
It was better or worse, and I behaved myself and did
Mm-hmm.
yoga and massage and kept up with my exercises. It was okay, but it was
Mm-hmm.
always there.
Mm-hmm.
And I was able to completely 100% alleviate it with Cranio.
Awesome.
Um, I've been able to work through some severe emotional traumas that I
Yeah.
had, and I've seen it do absolutely amazing things for both people, in my life and for my
Mm-hmm.
clients. And so I'm here to espouse, like
Right.
everyone, craniosacral
Right,
all the time.
right.
I really do. I think that people need to be more aware of what it can do
Absolutely.
I've worked with, like I said, teaching people to do this on themselves, on their loved ones, working with professionals, integrating it more into PT practices and
Mm-hmm.
OT practices and even dental and orthodontic practices.
Yeah.
It's such a valuable healing tool that I I am so grateful
Yeah.
that I was brought into my life that day.
Yeah. Yeah. So is there anybody that it's not recommended for? I mean, you've mentioned children, people at
Yeah.
the end of life, everywhere in between, different medical practices and that as well. So is there anybody that it's not recommended for?
There's only a couple of situations where it's not recommended.
Mm-hmm.
That's any time where there is untreated, unchecked, increased intracranial pressure.
Okay. Okay.
So if there's once there's a shunt in place
Mm-hmm.
or the cranial pressure is controlled, then it's fine.
Yeah.
Um, if there's a head injury where there could be a skull fracture,
Oh, okay.
so like I said, it's wonderful for concussions and
Mm-hmm.
actually should be done almost immediately after a concussion.
Mm-hmm.
The sooner the better, right?
Yeah.
But after we're sure that there is no skull fracture.
Yeah.
And then some of the more advanced imagery work and somato-emotional release is not recommended for people who are dealing with schizophrenia or
Mm-hmm.
schizoaffective disorders.
That's where I was thinking at first when
Mhm.
I asked. Yeah. Okay. Yeah.
Yeah. They can still benefit from craniosacral, just
Yeah.
not some of the somato-emotional work.
Right, right. Yeah, so you also, we should mention, we've been talking about craniosacral therapy. So you want to talk just a little bit, just briefly about the other services that you offered
No,
to me.
totally. So I really only provide craniosacral services these days.
Okay, okay.
I am trained, and now that's how much I love craniosacral therapy because I
hmm
am trained as a clinical herbalist. I
Okay.
am a Reiki master teacher.
hmm
A lot of people actually ask, is craniosacral like Reiki? Is Reiki like craniosacral? I can see where people get confused,
hmm
but the simple answer is they are very different.
Right. Isn't
Um,
like Reiki more of like the energy you bring in from
right.
somewhere else, whereas this sounds like it's more on the inside of the person and not
That
coming
is
from anywhere
almost
else.
exactly what I tell people.
Yeah.
Because there's a lot of subtle differences, but the largest difference is that like Reiki is channeling something else in,
Yeah.
whereas craniosacral is going inward to listen to your inner wisdom.
Right. Yeah.
The inner wisdom is a huge concept in craniosacral therapy, getting in touch with the inner wisdom and allowing the inner wisdom to take the driver's seat for
Yeah.
you. So it's
Yeah.
not bringing anything else in, obviously not bringing religion
Right.
into any of these things, but I do often have clients that ask, well, is this like Reiki? Is this bringing something in? People that have
Yeah.
concerns about things like Reiki. No, craniosacral therapy is
Just
nothing
within
like that.
yourself.
It's
Yeah.
completely and entirely within yourself.
Yeah. So you obviously this is something that you have to do in person. So and you've mentioned retreats and groups and that. So where is the best place for people to find you? And is there anything that you do that is online?
That actually brings up a really fascinating side of this. So it does not have to be in person.
Oh my
Uh,
goodness.
I
Okay.
know. So
Okay.
so prior
I'm
to
like, obviously.
prior to COVID, I think just about everybody was like, well, obviously this,
Right. Right.
but of course, the great COVID,
It
forced
was a
us all
big
into our
changer.
homes,
Yeah.
and necessity is the mother of invention,
hmm
which brought together a lot of us to be able to understand that a lot of this does not need to be in person. There
That's
are certain aspects
fascinating.
that do need to be in person, but there's a lot that doesn't.
Yeah.
Obviously, teaching people and training them to be able to do self-work and to work on others does not need to be in person. When you're working with the inner wisdom and you're
Mm-hmm.
learning to be able to palpate that cranial rhythm, a lot of it is visual.
Mm.
And a lot of it you're able to actually see with people to be able to guide them through like self-corrections.
Oh, okay.
And so it does not necessarily need to be in person. However, I do love to work on people in person.
Okay.
And so for many, many years, for almost 20 years, I had an in-person practice here in the mountains of Southwest Montana.
Mm-hmm.
I gave up my full-time space
Okay.
in favor of doing more workshops and retreats and teaching. So I travel. I do some workshops and retreats at Boulder Hot Springs here in
Okay.
Montana. There's an intensive that I do every August
Mm-hmm.
that is absolutely fantastic. If anyone would like more information about that, it's a 3-day intensive where you actually have 3 to 5 craniosacral therapists working with you at one time
Wow.
for a couple. It's oh yeah, it's
It's intense.
absolutely intense,
Mm-hmm.
and for about 2 hours for 3 days in a row. And sometimes we do some extra work in the water as well, just
Mm-hmm.
because there's nothing like craniosacral in the water where you've got
And
to breathe.
if you're there,
Move.
I mean,
Oh,
yeah,
it's
why not?
fantastic.
Yeah.
I mean, I think probably some of the best work I've ever had. I had 12 therapists working on me
Wow.
in the water in this beautiful natural non-chlorinated hot
Yeah.
spring water out there in the middle of nowhere. Nothing like it.
Yeah.
Uh, it's absolutely fantastic. So I do workshops there. I also do some workshops down in Denver, Salt Lake City. I'm looking to go other places if people are interested in maybe
Nice.
hosting something, to have me come in and do some retreats and intensives or workshops wherever you are. And I'm also going to be launching an online self-healing program. So that's something that's a little more affordable for people that can't afford to, go to these multi-day retreats
Yeah, yeah.
or to travel for these things. Or, people that do want to do those things, but also want to have the ability to, work on themselves on a more daily basis,
Mm-hmm.
or, help their loved ones, help their children when they're not feeling well,
Yeah.
help kids through wearing braces, and orthodontia work is tremendously stressful on the craniosacral system, and it's
Yeah.
something that we can guide and make much easier and much faster. There's a ton of research into how much it can help with um, all the recovery of all sorts of different illnesses,
Mm-hmm.
injuries, those kinds of things, but also
Yeah.
just general wellness.
Yeah. So where's the best place for people to reach you?
So the best place for people to reach me is through my social media page on either Facebook or Instagram, which
Okay.
we'll have links to
Yeah.
in the show notes here. But through Facebook or Instagram, and like I said, I'm going to be launching this self-healing program, so I'll have a little bit more organized way for people to go into that and just get more information immediately without actually having to message or call us. But for
Okay.
now, that's the best way.
Okay. And then you'll have information about that coming up on your social
Yes.
media, I'm sure.
Yes, that I will be posting all about that on my social media. It's
Yeah.
something I've been working on for the last several months, so I'm very excited to finally be able to launch that.
Yeah. So your Facebook is Holistic Bodywork Therapy,
Yes,
correct?
Holistic Bodywork Therapy is the company name that I'm under.
Oh, okay.
It's me. I own
You
Holistic
are the
Bodywork
company.
Therapy. Yeah, I am the
Okay.
company. That's me.
Okay. That's your
But
company name, though. Okay.
right, that's my company name. And the Christine Trafford is
Okay. On
my
Instagram.
my Instagram.
Okay. Okay. And definitely we'll have those links below. And is there anything else that you would like to make sure that people know or make sure that you share before we end this today?
I think if your interest is piqued by this, if your interest is piqued by craniosacral therapy, or maybe you heard of craniosacral before and it kind of is like, oh yeah, that, and if it feels like something that you want to explore, but it maybe feels a little bit scary, just notice that. Just
Mm,
notice what that is, because that is a big part of craniosacral therapy, is the listening, right? And beginning to listen to what your body's leaning towards, what your body's asking for. If it's, saying like, yes, listen to this, but oh, it's also kind of scary. What is that?
yeah.
And just checking into that, just listening to it, not trying to force or push through or push past, because that's how we end up back in our negative cycles.
Yeah.
That's how we end up back doom scrolling through social media for hours, or whatever it is that we do to kind of not listen, to,
Mm-hmm.
to, to tune out the signals that we're getting from ourselves.
Yeah.
And so it just start practicing that. Start practicing that listening, and seeing what that really is for
Yeah.
you.
Yeah, great message, and a great way to begin to do that work. I mean, that's
Yeah.
a great first step to begin to do that inner work. Absolutely. I love that. So I want to thank you so much for being my guest today. It goes by so quick. I always say
I
this, but I'm
know, it
always
really
so
does.
amazed. We've learned so much in such a little amount of time. So
Well,
really
thank you so
appreciate
much
you
for
being
having
here.
me. Yeah,
Absolutely.
it's
Everybody,
wonderful.
yeah, let's, learn and heal and grow together and share this out. And
Because
yeah, or
we
make
are
sure.
doing this together. You don't have to do it alone. This is us
Absolutely.
feeling out loud in community, and
Yes.
not trying to like hole up and pretend like it's all on us anymore.
Yeah, you're not alone. Nobody can do it for you, but you don't have to do it alone. That's for sure.
Exactly.
I always say that.
Exactly.
So thank you once again. And yeah, read the description below, read the show notes on the podcast. Yeah, thank you everyone for being here.
Thank you, everybody.